All righty, folks. I see folks are still joining, but we're going to get started to give ourselves as much time as possible for today's topic. So thank you all for joining today's webinar. Good afternoon, everyone. Before I begin, I just want to cover a couple of logistical issues. If you have any problems during the course of the webinar, just go to the chat and chat into our host, Kiara. She'll deal with any issues you may be having during the course of the webinar. And then at the end of today's webinar, please complete our brief survey to give us some ideas or feedback on today's offering, but also ideas of any offerings you'd like on this topic or any other topic that we can address in the CTAC. And during the webinar, you can chat in your comments or questions as we go, and we'll accumulate those, and then we'll save them towards the end or to the end of the webinar for our Q&A period, our formal Q&A period. So on behalf of the Community Technical Assistance Center of New York, it's my pleasure to welcome you to today's mental health moment. This is an opportunity that we have now and then to address kind of some of the salient issues that are going on in the world of mental health. And today's mental health moment, as you can see, is going to be focusing on the Great Resignation, the needs of frontline workers out there. That I'm sure many people are aware of. I'm the director. My name is Jim Rodriguez. I'm the director of Trauma-Informed Services at the McSilver Institute and the CTAC. I'll be moderating this mental health moment. And I'm joined today by Glenn Liebman of the Mental Health Association of New York State. Glenn is the CEO, has been the CEO of the Mental Health Association of New York State, MHANYS, for the last 18 years. He is MHANYS, if you don't know, is an organization that's dedicated, and it has 25 affiliates in 52 counties around New York State. Members of MHANYS provide community-based services, mental health services, and are engaged deeply in advocacy work around mental health and education and public awareness about mental health and mental illness. And prior to his work at MHANYS, Glenn worked at the Office of Mental Health and Department of Health in New York State. And Glenn has been working with a group, a frontline workers group, for a while to collect data and understand the factors that are contributing to the Great Resignation and shortages in the workforce across a number of sectors. And he's going to share and provide information based on his work in a report that that group has been working on to New York State. Before I turn it over and begin to talk to Glenn about the issue, I'm going to just share a few things that might be helpful just to set the level and give folks an idea of where we are. I think many of you, we're all kind of aware of the Great Resignation. This is some data from the Pew Research Center. These are some of the reasons why workers are leaving their places of employment. And again, this is a cross sector. This isn't specific to frontline workers or more specifically behavioral health workers. But in general, these are some of the issues. And you could see here that some of the top reasons why folks are leaving. Of course, pay will always be at the top of the list of that. But as you can see, some other factors include few opportunities for advancement, feeling disrespected at work. And that's an organizational issue that we can talk about, and that's a space where we could work. As you look at some of the other issues, of course, childcare issues being not having enough flexibility, poor benefits. These are, again, some of the reasons why folks are leaving the workforce. And I should point out that this sort of Great Resignation across sectors is happening, but of course, in the world of behavioral health, it's happening among mental health workers out there, probably at a time when mental health care needs are greatest in the community. And so we're seeing obviously a huge crisis in mental health because of worker shortages across systems. These are some of the difficulties that folks are presenting with. This is data from the Kaiser Family Foundation and the Washington Post. So again, many of you are maybe experiencing these or know of folks who are, but trouble sleeping, frequent headaches, somatic complaints, increased alcohol or drug use, when you look at the numbers, over 50% of folks are experiencing these or some combination of these issues. And I should point out that rates of depression and anxiety in the population among adults right now are 3 times greater than they were pre-pandemic. And I was looking at some data today that is showing that 132 million Americans are living in areas where there are mental health worker shortages. Again, creating some of that crisis in mental health services that we're seeing. And that's a huge number. And just to be clear, that's 132 million people living in those areas. That, of course, that doesn't mean that they're all affected by these mental health issues. And then this is just some data on some of the demographic characteristics of folks who are leaving their jobs. So we see, again, healthcare workers and folks in the healthcare field are high, even higher. Those in food and retail and hospitality services. And then when you look at ethnicity, breakdowns by race and ethnicity, African Americans and Asians are leaving their work at higher rates or considering leaving their work at higher rates. And when you look at income levels, again, folks on the lower income side of the spectrum are also leaving their work at higher rates. And then job level, entry level workers or workers sort of starting out are also leaving or thinking about leaving at higher rates. And so with all of this as a backdrop, I'm going to turn now and talk to Glenn about his experiences. Stop sharing here. With the Frontline Workers Group. So welcome, Glenn.
Hi, Jim. How are you? Nice to see you.
Very good. Very good. So Glenn, if you want to start off, and again, if there's anything that you want to add to your bio that I didn't touch on, please do so. But also, I wanted to start by asking you about the Frontline Workers Group and how that came to be.
Sure. So, again, I really appreciate this opportunity and I look forward to discussing this with you. So it really came about, and I give Deb Faust from my office, who runs our family services programs, our Care Path program, and John Richter, our public policy director, really were a lot of the driving forces behind our engagement in discussions around, the importance of trauma-informed care in the workplace and the legislation. So it really came about. I mean, I think you would have had to live under a rock to realize the impact of COVID to what it meant to people in the workplace. I mean, we saw obviously all the dramatic footage of people in hospitals, but it was much greater than that. And a lot of it was impacting our workforce directly. A lot of people in our mental health workforce were the real heroes as well. They were courageously going in. If you worked in a community residence, it's not like you could say, I'm not going to go to that community residence today because it's COVID related. No, you had to be in work every day. And there were so many examples of that. And so people in our field were going in every day into work, and people across the sectors. This wasn't just, again, we talk about mental health, but it was more than about mental health. We were impacting every sector: education, transportation, everywhere you go, law enforcement. Everybody was impacted directly by COVID. So what we said was we have to have a really informed response. So we had put together a series of legislative ideas that we ran by the leadership of the mental hygiene committees in the Assembly and the Senate, who were friends, colleagues. We've worked with them for a long time, and they themselves were trying to get responses. They themselves, in the positions they were in, they saw it from their constituents. They were looking about the greater good of the community. They recognized the long-term traumatic impacts of COVID. They wanted to be as upfront as possible. So we were kicking around a number of ideas, and this idea of an advisory committee came up. And this advisory committee was just exactly what we needed, because the advisory committee would draw in the expertise from across the board. It would bring in people who, again, as I said, They were people who were experts in all different sectors. So it wasn't just the mental hygiene folks around. Yes, we were involved, of course, but it was also, again, we had the farming industry involved. We had unions involved. We had transportation workers involved. We had the whole panoply of experts in the fields and the different fields to come together and produce a series of recommendations and have some really robust discussions about this. And I think it was very successful. I think that the MHANYS co-chaired with the Office of Mental Health, and it was moderated by CCSI. Rochester did a wonderful job, and I think we had some really good discussions. And I think we came up with initially a series of recommendations that we thought were very powerful. And our initial startup was we really wanted, and this was something that when we worked with the legislature, it was Assemblywoman Aileen Gunther and at the time Senator David Carlucci, who since left office. But what we did was we really wanted to be time sensitive, at least around initial recommendations, because we were hoping to have those initial recommendations done before legislative session started in Albany. So we would have an opportunity to talk about this during legislative session, talk about these recommendations. So Jim, it was really, again, and obviously we'll get into the recommendations, but it really was a very organic process. And I think that I was just amazed by the level of expertise of the peers, the families, the providers, everybody who was involved in these discussions had a lot to add to the discussion group. So it was very, very successful, I thought.
Right. So, yeah. And as I talked, I know, of course, our audience is our, sort of members of the behavioral health field and work in behavioral health. So I know, and it's interesting that you and I were having this discussion prior to this, right? Those folks, you folks in the audience are obviously impacted by everything that's happened by everyone, but you're also in the space and in the place and doing the work around supporting those folks who are impacted as well. And it's a difficult place to be. I'm curious though, just generally, with regards to the problem and the issues that folks were talking about, what did you all find? What came up as, and to what degree does it align with some of the data that I was sharing at the beginning?
It is very consistent with the data that you were sharing. It is, it's sort of a dual problem, Jim. I mean, we have those issues, those ongoing issues from the pandemic around trauma, but similarly, we've had the ongoing issues of workforce for many, many years and the workforce crisis in the mental health. So they've kind of, obviously with COVID, we've sort of seen this cross of the two of them. And a lot of what came out of our discussions and I try to bifurcate in some way, because a lot of that discussion was going on simultaneously as we were having discussions more broadly from a public policy perspective in our advocacy around workforce and what we can do to enhance the workforce. So, but again, there was this sort of like, they were very intertwined. But in terms of the specifics around what we were looking for from the advisory committee was kind of a series of recommendations that I think were very common sense. And again, very smart people were involved, but public awareness was a big piece of what we were discussing. People don't know necessarily, people hear trauma-informed care, they hear kicked around, they don't know what it is, and talk about trauma-informed care, talk about it in the sort of in the world of kind of like for the general public, for have a greater understanding about what this means, because as we know, most people have had some sort of trauma incident over the course of their lives. As we know, it's across the board for most people. So we wanted to make sure that people had a greater public awareness about it. And at the same time, we wanted to identify best practices that were out there in the field. What are the best practices that are out there regarding trauma-informed care? What can we do differently? How do we change an environment? How do we consistently change an environment to make it a trauma-informed environment in the workplace? That was a huge part of what we were doing. And then we were talking about trainings and screenings And, they were all different pieces of what we put together in terms of recommendations. But if concurrently, again, as I say, concurrently, we were also looking at the workplace from, at our workforce from an advocacy perspective. So we saw things that we know about our workforce. We know that our workforce is incredibly undercompensated for very, very difficult jobs. They are in this field for the right reasons. People are mission driven. And that became very clear after COVID, that they became even more mission driven because they were sitting back and saying, what do I do differently in my life now? How can I make a difference in my life? So it became even more mission driven during the process. But as I constantly say, a standard line is mission driven doesn't pay the rent. So it really is about, compensation. And I can get into more of that discussion a little more broadly later, but it really became sort of like a rallying cry for our workforce around additional funding, additional other opportunities, which I will get into as well as we move forward in the conversation.
I'm curious, and yeah, I definitely want to get to those. To go back in terms of who was affected, who was impacted, I'm curious if the report sort of was able to identify any disparities. I know, again, we're seeing a lot of information about disparities and among people of color, communities of color, low-income communities. Can you say a little bit about that in terms of who was impacted most during this pandemic and by these?
Yes, and you're absolutely right, Jim. It was clearly the population, the BIPOC community was really, people in certain economic status were really impacted much more dramatically by, obviously by COVID and then, enhanced through the trauma piece as well, that all of a sudden the trauma issues in that community were even risen to a level that we had not seen before. And it was clear to us and, everything that was going on, that this was a crisis, that we had to be more responsible in this crisis. And you'll when our final report comes out, there was a series of recommendations that will likely come forward talking about this disproportionate need that's out there. And I think that will definitely, be identified as a priority issue. And hopefully what will happen from these recommendations is there'll be some, funding behind it to kind of go out there and do this work in communities that are, communities of color. And, so we're definitely responsive to that. And I think that the committee was very responsive to that need. And I think it'll be reflected in the final recommendations.
Well, Glenn, let's talk a little bit about those recommendations. So, kind of in reading the interim report, and for folks who are interested, the interim report is already publicly available. So if folks want to take a look at that, we can post that along with the recording of this webinar on our website within a couple of days. But I did notice, and you've been alluding to it, a trauma-informed approach. You talk a lot about that in the interim report. I'm curious, what do you mean by that? That's the space that I work in, but from
Sure, of course, it.
And the advisory group's perspective, what does that mean for frontline workers?
So I think what it means is that basically, as we know, a trauma-informed approach is a comprehensive approach that looks at, kind of organizationally, how can we be more responsive to the needs of individuals when they're going through, issues of trauma? What can we as organizations do differently? How can we be more responsive? What can we do to recognize that we don't want to re-traumatize people who've already been traumatized? So it basically creates an environment that is, I don't want to say intuitive, because it should be intuitive. It's not necessarily intuitive at this point, but it's an environment where people, there's a greater collaboration, there's greater respect, there's greater understanding of what people are going through in life, and understanding that, people have sort of, they come at their jobs from different perspectives. They come at their work from different perspectives, and to understand much more how we can be more responsive to their needs and be more supportive. And frankly, a lot of the work around trauma-informed care should be best practice in general. I look at this, and when we were doing the work on this, and I'm not, there are many more people than me who are much more expert in the field, but I'm looking at this and I'm saying, this is just good practice. We should be practicing this on a daily basis. This is the kind of thing where we have to have a comprehensive response in an environment where people are feeling safe and secure, and feeling that they have a collaborative approach, and feeling that they have teamwork. All those things that are necessary for good work, productive work, is also part of a trauma-informed approach. And maybe down the road, and probably there are people a lot smarter than I am who are looking into this already, as trauma-informed, is becoming discussed more and more, that people who are not in our world are looking at this and saying, how do we look at workplace wellness differently? How do we look at a strategy that we are trauma-informed, that is so completely, geared to an individual and how they can, respond to their own trauma needs? So that's kind of a long-winded response to a question about that. Clearly, there is an environmental change that needs to happen across our workforce to identify how we can do, have best practices in our field.
Right. Well, and it occurs to me, Glenn, I might put you on the spot here, but I'm wondering if, and I think this was also alluded to in the interim report, that organizations who do practice trauma-informed care in the organization for their staff and for their workers. A couple of questions. What do we know? I mean, what are some of the characteristics of those organizations? And to what degree are they able to weather this storm better than others? And I guess to put you on the spot a little bit, Glenn, you're the CEO of an organization, a mental health organization. So I'm curious about your practices and to what degree you've been able to weather this storm.
Well, yeah, thanks, Jim. It's funny because I was looking at all the people introducing themselves, and I have a lot of our staff is participating. So hopefully they're agreeing with what I'm saying. What's he talking about? No, I think it comes from the top. I think that you have to have a great respect for your staff. You have to listen to what they have to say. They are they're our most important resource, our staff. I mean, we hire staff, we take our time hiring staff, and obviously we know that it's very difficult to hire staff these days. We know all those issues, but the staff we have, I think, are top notch. And I think that you have to have them, rely on them to do their work in a way where you give them a level of independence, but at the same time, you are clear in what you need in terms of objectives. But I think it's got to start at the top, I think, in terms of that. But we also have to have, policies and procedures in place that address concerns. People have to feel that there is a place they can go if they have concerns about what's happening with them in their own trauma. So you have to have strong policies and procedures in place. And we want to create, and again, we're in a hybrid office, like so many people are, where people come in some days, people not in other days. And I just as an aside, Jim, I don't want to get off topic too much, but as an aside, I'm an old school guy. I've been working since I'm 16 and I'm in my 60s, and I've always, every day you get dressed, you go to work, and it was drilled in me by my father. And so the last few years have been difficult for me because I'm now, it's hybrid and we have staff that is hybrid, but I've learned, I think my own flexibility is learning that people are doing great work. They don't have to be physically in our office to do great work. I miss people being in the office on a regular basis, but you don't have to physically be in the office to do great work. But I think those kinds of things, you got to create the workplace as a safe space for individuals.
Yeah.
You have to have peer support, collaboration, of course, cultural humility, empowerment. In a word, you're trying to create this environment of really feeling that people are feeling comfortable at work, that it's not an environment where people feel restricted, where there's a lot of tension going on. You just, you want to create a positive environment.
Yeah. Yeah. Well, and it's funny because it wasn't so much an aside, because you hit one of those, one of those factors that I think I shared from the Pew Research Foundation is that lack of flexibility in work hours. And I think you're identifying one of those right on and addressing it. I'm going to push you a little bit, Glenn, for some more. What are some other things? And I think and I guess as you think about worker shortages, there's a few ways. One is, how do you keep folks?
Yeah.
I think the other thing is, how do you bring folks back in? Right now, people have left or are leaving. How do you keep folks? How do you recruit them and bring them back in? And of course, how do you make sure you're taking care of them? But as we think about those different areas, what are some of the things that can be done to make sure that we're retaining folks? I know you're talking about one very specific issue, right? Flexibility, and that's very much a part of the time. What are some other things that you're thinking that you can do as an organizational leader, but other organizations can do?
Sure. So there are a few. I kind of divide this up into two different areas, sort of like a concept and then sort of pragmatic approaches. So in terms of concepts, just the concepts we alluded to just now, the key to, again, so many people in the human service field, in the mental health field, is they come on because maybe they're family members, maybe they're peers, or they're coming on because of a sense of purpose, that they're looking at this and they're saying, I really want to make a difference. And this is a field where I think I can really make a difference. And we have to do everything to make sure that those people are motivated to stay in our world. And, we have to make sure there's respect. We have to make sure that we provide feedback, and we have to create the concept of teamwork. Teamwork is essential to all this that we're doing to help to keep people motivated and feel they're making a difference in people's lives. Pragmatically, I have a series of things that we've talked about. Again, we're kind of in the front lines in the advocacy world around the workforce. So we have a series of things that we talk about. Money, of course. And I give Governor Hochul a lot of credit. There was a cost of living adjustment this year that's based on the Consumer Price Index. It was 5.4%. And we have to fight for it every year. And a lot of years we haven't gotten it. Over the last 14 years, we haven't gotten it, or we've gotten bits and pieces. She provided the whole 5.4% in the budget, which was, over $500 million for the human service sector. Well deserved, well needed, but also we appreciate that she was responsive to that need. And just today, I saw that, one of the other pieces she talked about was bonus payments to people who are doing direct care work in their communities across the mental health, behavioral health world, the health world, that there's up to a $3,000 bonus that's going to be going out there as well for those of the people who are front facing in our community. So, this is all good stuff. That money is one time. The 5.4% is fully in the budget. But the other thing, of course, Jim, is tuition reimbursements. A lot of people want to go back to school. There are a lot of people in our field who have not had the ability to go to school for a myriad of reasons. I think that's an important piece of this. Career ladders are essential. People want to feel like when they're in this world that there's a place they can grow to. What's the next level in the rung that I can move towards? I mentioned peer support and respect, of course. Flex time is a big issue. You talked about that. The flexibility is a big issue. Onboarding and orientation, huge issues. People have to be onboarded, feel like they're part of a bigger, that first of all, they have to be onboarded for a series of reasons, but they have to feel that they are part of a bigger mission, that it's not just them individually, they're part of a larger collective. So when you're part, again, I'm personalizing it. But when you're part of the MHA movement, you're part of a movement that's been around for over 100 years. That's been a movement that has made so many strides in terms of helping people with mental health recover, move forward in their lives, shun shun public hatred of people who have hatred's too strong a word, but shun the stigma that's gone on with people with mental health issues for many, many years, the discrimination. So this is, to make people know that they're part of a bigger picture. Uh, Things like wellness offerings. Are people getting, can they get discounts? And, a lot of it's through your health insurance plans. But also, are you have the ability to have discounts at gyms? Are you getting programs for meditation? Are you getting programs for yoga, et cetera, et cetera? Training, obviously, is a big piece of this, and this goes hand in hand with sort of people in career ladders. Are they taking advantage of every training? Are you giving them every opportunity to be provided with the trainings that they need? Are you feeling like they're taking advantage of all trainings that are out there? And certainly that's something that we highly recommend in terms of an effective workplace. And again, at the end of the day, sadly, all these things come into play, and many of us talk about this all the time, and we offer it to some degree, but people still leave our field because they can't financially afford to stay. We have vacancy rates 30-35%, and all these good people who are working here are moving on to jobs where it pays more money and they don't have to do as much work. So it's a pragmatic decision sometimes, and we get it. We don't like it, but we get that that's what people do.
Right, right. Yeah. And I'm curious, I think you're talking about this in terms of how do you bring people back? And I think a lot of the recommendations you've already made speak both to retaining folks, but also attracting folks back. Are there other things that can be done to incentivize bringing people back into? You've already addressed many of them, so I don't know if there's additional ways for bringing folks back in.
I think that we, as a system, and I know it does, I don't know if it directly answers your question, but I think we as a system have to do a better job, and I'm talking the whole system, of recruiting people to be in our field, to make our field attractive to people. The mental health field has long been stigmatized, and people come into it, as I've repeated myself now several times, for the right reasons, but we have been in a community that's been so stigmatized and so marginalized for so many years that it's very hard to get our workforce incentivized, people to be incentivized to be in our workforce. Now that's changing. I see this. We have a program, our School Mental Health Resource Center, where we're in schools on a regular basis, and it's evolving. The students of today are so different from the students of the past. They don't see, mental health as some sort of issue. They see it as sort of like that they're normalizing it. Like, oh, I have serious anxiety today, or I'm depressed today. I mean, it's normalized conversation, which is wonderful. And that's the great hope for the future, that they're having these conversations and those are ongoing and they're feeling comfortable talking about that. So I think as a community, we have to take advantage of that to start layering in sort of people talking about the professional career in mental health and what that would look like, and to bring that conversation in. Back when I was a kid in the 1800s, some people would say that, but the stagecoaches would come to our door and we would, but seriously, we would have career days, and I'm sure they still have career days, and people would come in and talk about their careers and incentivize people to join that field. And that would make so much sense, to have people in the mental health field come in and have those kinds of discussions to say, this can be a career. And then you move it up the ladder, and then you say, okay, not only are we having these conversations in high school, but now there are offerings in college specifically, not only about a mental health counselor or social work or psychiatrist, but as a mental health frontline worker, we should be having those kinds. And I know that there are some seeds of that across our communities, but we should have classes dedicated
Yeah.
specifically so you can become a mental health specialist or whatever you want to call it. And, it can start at community college and then move up to four-year school, however you frame it. But this is sort of a sequential model that we should be talking about because
Right.
we see this now at a young age and we should take advantage of it.
Yeah. Yeah. No, you have me at creating schools for mental health specialists. It's been something that I've always dreamed of. You have schools for STEM, right? STEM schools,
Great.
sort of science and math, engineering,
Yep.
sometimes medical sciences, kind of more specifically. But yeah, I've always thought, why don't we have schools for mental health professionals? The
Yeah.
psychologists and social workers and other mental health professionals of the future,
Yeah.
and licensed mental health counselors. All of those, yeah, that
Yeah.
would be awesome. Yeah.
Yeah. All right,
So
we'll work on it, Jim. You and I'll we'll put
exactly,
it
yeah.
together.
Let's create that. Anybody
There you
want
go.
to join us? Please chat in. Let me ask you this. So we normally ask this question, sort of, what's the one message you would like to leave folks? But we have different groups here. What I'm wondering is, so you have organizational leaders, you have policymakers that can be involved in this, and obviously, the frontline workers themselves, you all in the audience. And what I'm wondering is, what would be one thing that you would tell those groups? So for example, what is one piece of advice that you would give organizational leaders at this time, or pieces of advice you would give organizational leaders at this time that they can walk away with, one thing that they can do tomorrow that can make a difference in recruiting, retaining, and supporting frontline workers in the behavioral health field or generally?
Well, I think that the giveaway on this is, I thinking about this is that, we talk about this issue, and obviously, I think most providers in our world are, doing the best they can with limited funding. And so the one thing I would reference, and again, the fiscal issues, always the fiscal issues, you talk to anyone in our field, they're always going to say fiscal issues are top issues. But I think it's almost, Jim, like you create another almost sort of benefit package. Yes, of course, you have your traditional health care, you have your traditional other insurance, but a benefit package that sort of aligns with trauma-informed care, where, okay, here's your benefit package. So when you're, as an organization, when you're signing up to be, when you're signing up to work in our organization, you have your own sort of semi-benefit package that go, again, beyond traditional healthcare. You're talking about the things I talked about before: wellness offerings, trainings, flex time, career ladders. You put that all in sort of like when you're going through your orientation, you're talking about the possibility that might exist for an individual to better themselves and to stay with your organization because they know it's an organization that's a good quality organization that's doing all the right things. But this is also something where you have the ability to move forward in your own career because you have all these possibilities that are out there for you. So it's almost like a almost, again, when we were talking about, we were talking about onboarding, it's almost like this orientation discussion about, here's another benefit package for you. Yes, you'll have your traditional benefit packages, 403B, et cetera, but here's a different kind of benefit package for you. So it's sort of that's kind of as an organizational thing, I would definitely, discuss that.
Well, yeah. So so another group, and this one might be a little touchy. So for policymakers out there, what's one thing that policymakers can do that can make a difference? What was one thing that, or to put it differently, what would you like to see?
Well, what I would like to see.
What you think would make a difference?
Two things. Both of them are, and I think they can be more than aspirational. I think that they're doable. I think we've seen with the governor who did what she did last year that she clearly has an interest in human services and behavioral health. And I think that, and this is going to be a tough one, but the cost of living adjustment every year, the COLA, which we got the 5.4%. This year with inflation, it's based on the consumer price index. The consumer price index this year, Jim, is, as we know with inflation, is over 9%. So one of the things we're fighting for is not only mental health, but the entire human service sector is fighting to see something along those lines happen in this coming year's budget, a 9% funding increase. We know it's going to be a difficult ask. We know it's going to be a difficult fight, but that has never dissuaded us from doing what is right, because we know that 5.4% last year was just an investment in the future. This is the continuation of that, and I think that's one of the things. The other thing, which has long been a dream of mine, and I have a great board chair, Bill Liebman, who runs a large provider agency in Albany, and it's there throughout the state. But Bill and I have talked about this often, and we've brought it up to legislative staff as well, is the idea of us becoming part of the state's pension system. Why wouldn't the nonprofit sector? We are a vital part of the state's economy. We're out there every day doing great work. We're doing work that state employees are doing as well. We're getting paid less for it. Statistically, we know that. We're getting paid less in the private sector. Why can't we have the same ability to join a pension system, much like the state's pension system? So we can have people for many, many years. Why do people stay in their positions? A lot of times people stay in their positions because they know they're going to be vested in a pension system. If we had some sort of, again, excuse me, this is somewhat aspirational, but I think, there are possibilities that do exist, and we will continue to fight that fight, because sometimes, as we know, aspirational becomes reality, and that's something we're going to keep pushing.
And then the last group, and I think this is the many folks in our audience today, the frontline workers themselves, these folks who are on the call today who are doing the work and continue to do the work out there. What is something they can do? What is something that folks out there who are in the audience could do tomorrow on their own behalf, and that can help them moving forward? What would you tell them?
Well, I would say we say this word a lot, and we say these two words a lot, or hyphenated word, self-care. We talk about it all the time. It means different things to different people, but I think that self-care is a big part of this. I think that people have to take care of themselves. They have to know sort of what they need in their personal lives, what they need with their personal struggles, whatever it is. And I think that we should, again, in terms of the workplace, EAPs, other entities should be very involved in a knowledge about what is self-care for different people. For self-care, for somebody, it might be yoga, meditation, working out. For somebody else, it could be journaling. It could be a myriad of different things for different people. I tell you, my self-care, I laugh about it, but it's true. I am a huge sports fan, and I collect sports cards. And for me, my self-care is going into my office and, dealing with my sports cards, the same as I did when I was 11, So everybody's got their different version of self-care, but I think that's an important part of what should be done for individuals. And again, the other piece is that agencies should make sure that trainings are available for individuals to help enhance their lives, help enhance their own career development, whether it be mental health first aid or psychological first aid, crisis response training. We're coming in, I know I'm off in a different world now, but we're coming into a world where 988 just started. We have to be very present and knowledgeable about what 988 means for our mental health community, and people should know about that. Now, that's not, somehow I got to moving towards that when we're really talking about individuals, but those kind of trainings are really important significant for people, so they have a greater understanding of, what's out there in terms of their community and their workforce.
Right. And I'm really glad you made that last point about what organizations can do, because I always feel strongly that, we want folks to practice self-care, but also there's self-care kind of suggests it's up to the individual to take care of themselves. But I think that last piece that you said, what's the organization's responsibility in promoting that as well? And I think some of the things that you've talked about, both when you were talking to organizational leaders, but also that last piece, right? What can organizations do to make sure and support that folks can practice self-care as well, so that responsibility isn't totally on the staff and the workers themselves.
Right, exactly. Right, yeah. Yeah.
Well,
And my
so
other stuff,
yeah.
I should say my other self-care real quick is I'm a fanatic Mets fan, so I have to, make sure to watch as many Mets
Oh
games.
no, just kidding.
Oh, Yankee
So
fan in the audience. Uh-oh.
yeah.
So,
Let's turn to our Q&A period. Please feel free, folks, to send in your questions for Glenn. And also, I would also put out to you folks your recommendations, your thoughts about what would help. Certainly, I think that Glenn's been in a position where he's been sort of working and hearing from folks, but certainly if you want to share your thoughts about what would help to support frontline workers moving forward, please feel free. So I'm gonna sort of monitor chat. I know some other comments and questions came in earlier. I'll take a look at those, but for right now, let's just look. Let's look at here. So Angela, thank you. Angela says, without equitable wages, realistic requirements from state funding sources, and greater accountability from insurance companies to reimburse services, individuals will continue to flee from this field. So you've addressed a couple of those, Glenn. Yeah, insurance reimbursement also being a way to generate. So if you want to respond.
I spot on. Again, we can sit here and we can talk about all the incentives in the world that we want to see happen. We can talk about all the, trainings and reimbursements and everything else. But at the end of the day, people have to live. They have to make a living. And until we have those equitable wages in our field, which we keep fighting for, until we have those equitable wages in our field, we're going to be in a losing battle for many people, unfortunately. And some of our people are working 2 and 3 jobs. It's, 25% of our people work a second job. And I don't know what percentage work a third job as well. It's very difficult. And if you have a family, it's even more difficult.
Right. I'm also seeing, so Ingrid Gomez, thank you. Ingrid says, I'm also thinking of worker cooperatives and how they, have a vested interest in their companies and flexibility with time and swapping time off, vacation days, and other benefits. Some of these recommendations should be considered. I'm not very familiar with worker cooperatives, Glenn. I don't know if you can speak to that.
No, I don't. I'm not as familiar with them as well. I think the idea behind a worker cooperative is not that much different than creating a pension system, like some, with agencies banding together to kind of create their own sort of like, identify a large number of people who are covered lives who might be attractive to work with in terms of developing a pension plan for, if you have enough covered lives.
Okay, great. And so it is sort of sharing, and it sounds like sharing and distributing resources together.
Yeah.
Okay.
Yep.
Let me see. So Euphemia. Hi, Euphemia. Euphemia's John says, Glenn's suggestion about nonprofits having pensions is something I have also been discussing that would help with the recruitment and retention of employees and would increase equitable budgets and for salaries. So just agreement with you. I don't know if there's anything more that you wanted to add about that, but you've kind of spoken to that issue.
Great respect for Euphemia. So if she thinks it's a good idea, then I feel like I'm validated. So.
Yeah, and I also say that too because I think knowing Euphemia's work, working with family and peer advocates and advocacy, peer run organizations and family run organizations. I don't know if you want to add anything about that specifically because I think that's the other piece to this, right? There are certain groups, and I should say during the course of the talk, I did see somebody mention even with the COLA increase that certain sectors were not. Home healthcare workers, for example, were not. So also the question of equitable distribution of these strategies becomes a big issue as well.
It is a huge issue. And, look, family organizations, peer-run organizations, they're the heart of the work that's being done. And they have to be, we have to make sure that they are given more than lip service, that they are a vital part of the work that goes on a daily basis. I come from the NAMI world. My first job in mental health, I was director of NAMI New York State, and that's always stayed with me in terms of the role of families. And I see how vital they are. I see how vital families together is, and I see how vital a lot of peer organizations. We work very closely with NIAPers, and the peer organizations drive a lot of what we do. And I think that that's an important part of the work that's being done, and we really have to acknowledge that. And that's a whole topic, Jim, for another day, and we can talk about that. You can bring in people much more expert than I am, but I think
Well, yeah,
really
but
important to recognize their significance.
of course, and I think and a related question, Raina, that kind of addresses it, I think in some ways, because a lot of the advocacy work. So I'll just summarize. But Raina's talking about is the advocacy. So the advocacy that you talked around, 9% increase in contracts and all of that. But is the advocacy happening as part of a collaborative or a coalition? Who's involved and what support is needed for the advocacy? So I think Raina's asking how can folks participate in that advocacy movement?
And that's great. At the end, I don't know if my email address is there. I know my Twitter account is there, but please feel free to reach out to me. We're part of a behavioral health coalition, of the statewide behavioral health advocates, but we're also part of a greater coalition, a larger not a greater per se greater, but a larger coalition with other members of the human service sector. We work very closely with a lot of the DD providers. We work very closely with the Human Services Council. We work very closely with Kafka and all those other agencies that are sort of pushing the same envelope that we are. And so the more voices we have, the stronger we are. So please feel free to reach out and,
Right.
Yeah.
Fantastic. And we will share that information with folks in a moment. So I think a few others that are coming in, more comments. Margaret, if people haven't seen John Oliver's talk on mental health, so I'm sure John Oliver covered this with broadcast Sunday, but should watch it. But he talks about how for every 10 people entering the system, 13 people leave. So, we have, again, dealing with the shortages. My colleague, Cara Dina Sale, is on the call. So if you want to learn more here about worker cooperatives, she put a link in the chat around learning a little bit more about worker cooperatives. So if you want to understand that and see what role that can play in all this, please feel free to click on that link that Cara sent. Thanks, Cara. And Teresa is sharing again her personal experience. I think as an LMSW who is working two jobs and needing more than one job to sustain. It is, and I think she also mentions her husband works two jobs too. So how difficult it is.
It's not right when you hear people. I don't want to talk about the equitability of our country or anything like that, but it's not fair when you're seeing people who are doing things that are much less significant to people's lives, making 5, 6, 10 times more money than a lot of people in our fields make. But that's just that's a discussion for another day.
Yeah. Let me just see this, and I think we'll try to get one more in.
Yep.
Yeah.
See what Esther's saying. Yep. You're probably right. It's probably more than 25%.
Yeah. I'm seeing Titi Lope Oladele. I hope I had that pronounced that right. They ask, how do you find the balance between holding team members accountable to the work and ensure high performance while empathizing with personal challenges, health issues, or trauma? And actually somebody also alluded to this earlier, right? So yeah, there is that issue, and I think it's a real one that we have to identify, right? Balancing accountability with self-care. I think that can oftentimes for organizational leader like yourself and others. So I think they go on to say, I find it incredibly difficult to strike the balance between being flexible, accommodating to our team, but ensuring that our work gets done. Yeah, great question. How do you address that?
Yeah, no, it's absolutely. There's no great answer that I have. I wish. That is the continuous issue that we have, and I think it's about accountability. We have to make sure that our staffs have a level of accountability, but also at the same time, we want to make sure that they have enough flexibility to be able to do what they do well. And we have to trust. This is where A lot of times we have to rely on, we have really great supervisors and strong supervisors who are empathetic, but at the same time, there's an expectation of work that has to be done. And it's that balance that more so now in the last, since the pandemic, but even before the pandemic, this balance has sort of become something that people have to work through, because it is difficult. It absolutely is difficult. I will say that I think that, and maybe I'm a bias because the people are, but I think the people in our field are driven to do the right thing and are more driven than probably a lot of people in other workplaces. I don't know, but so I think that they're much more likely to be able to do the hard work and the hard lifting that is necessary.
Yeah.
But
And I totally get it. And I would probably also add that I think, and I think Titi Lopez says that they are working on it, and they really do make the attempt to strike that balance.
Totally.
I would put out there though that I think our organizations have historically, and I certainly can't put statistics to it or anything, but I think the tendency oftentimes is to focus more on the accountability side, and I think increasingly the need to balance that. I think, and I think in some ways, from my perspective, supervision, you touched on it, but I think I want to sort of expand on that. The role of supervision can play such an incredibly important role. Those supervisors who are able to sort of be able to work with folks individually and balance those two become critically important. So I think that the role of supervisors can't be understated enough in being able to strike that balance. But yes, it's an issue that we all have to address as well.
It is, and you're right. Sometimes I think for many years we went the other way, and now I think we're trying to at least recognize the role that staff has in terms of their ability to to self-care, but at the same time provide really, again, for me it's been a learning experience because like I said earlier, I've been in an office setting for 40 something years. So for me, this was a real change, and I respect it now because I see people are still working very hard. So there is that balance, and I think that balance is hopefully shifting to a point where people are accountable, but at the same time, they're feeling that their work is of substance, and they're not feeling, they're feeling that they do have the work that the support that they need.
Yeah, absolutely. And the last thing I would say about that is unfortunately, keep working at it. And I think including staff and workers on identifying ways of doing that can also be powerful as well. So I want to take a quick moment. We're at time right now. So I just want to thank Glenn for a wonderful talk. I hope this has been helpful to folks. I really appreciate all of your input, your questions, and your comments throughout. Obviously, this is a major issue facing both the field, us as workers out there, but also it's a crisis in the country, because what affects us affects the ability to deliver high quality mental health services to the many folks who need it. So we're at a crisis both for mental health for the population out there, but among the workers as well. So it's something that we have to continue to address. I want to thank you all for participating. Here's also, for those of you who are interested in finding out a little bit more about those advocacy efforts, this is Glenn's information, or the information from MHANYS. You can reach out to MHANYS, and you have their Twitter account information as well. But please feel free to reach out to MHANYS and see what can be done to participate in some of those advocacy efforts. Again, I want you all to sort of thank Glenn for a wonderful presentation. And thank you all for your work, everything that you do, and for participating in today's mental health moment.
Thanks, Jim.
Take care, Glenn.
Thank you so much. Thanks, everyone.